hoping that most of you will get screened every day when you come to work because you are almost outside. And those who've got symptoms, stay home, and then we'll come and swab you at home. Thank you.
Thanks, MEC. My colleagues, if there are any questions, just indicate by show of hand. Just indicate the media house and your name, where you come from. So I'll take hands. Criselda, 1, 2, 3, 4, 4, how? Is there anybody else? 5 TD, 6 at the back. Sure.
Good afternoon, I am Criselda Lewis from SABC Television. MEC, how many healthcare workers are we expecting plus minus to be employed here? And is government paid to be here? And how much?
Actually, you started with my question. We know that there's a point shortage of healthcare workers in the country with no people. So where will these healthcare workers come from? Specifically work in this sector.
Hi, I'm Masuku from Eyewitness News. Is there, since it's a makeshift another plans to open other ones in the province too, particularly when it comes to these issues of COVID-19? You said you need so many beds, but is there another plan to open other institutions like this one? Thank you.
She asked my question about
thank you, TD from TD Media from News 24. Bonga kind of mentioned a little bit of what I also wanted to ask about other areas. When you and I spoke about a week ago, you mentioned Swanyu, an area that will cater for the West Rand and the East. So I wanted to also find out about other facilities, and also just to ask, the beds that we have here, are those donated? How many of them exist already? How many more are you expecting? Are you still on the drive to get donations to come to assist? Thank you.
Linda, was that a hand?
Yes. Linda Basic News from Africa. Mine is just clarity maybe on my mother's question rather. Are you going to be going for like retired nurses as well? Are you going to be ramping up the health workers in terms of looking at, medical students as well to come and assist in this particular incident?
Thanks, MEC. Oh, sorry.
I'm from AFC on testing. How many tests are you doing every day in Gauteng, and do you think that's enough?
Okay, maybe let's start with the issue of the costs. At the moment, we are still working on costing, but we are at a way that we are going to build these facilities through sponsorships. We've received good offers from different organizations and individuals, from different companies, and all of them, I think, were on the right time. We'll be able to announce all of them that would have contributed to this type of actually facilities. And also you'll remember that the Solidarity Fund is also aimed at pulling the resources together, and all of us donating to the Solidarity Fund to make sure that we're able to cater and be able to pay for such actually facilities. But overall is that when we started with the fight against pandemic is that all the business people and the corporate side of the world, we have requested them to be very clear that we are not in for profit, and they are also contributing towards the fight against the pandemic. So most of the things that we are paying for and that we are actually doing across not only about the facilities, they are almost at cost, but we are working with different organizations who have come forward, to offer some resources and particular cash on this one. On terms of nurses and doctors, the issue here is that it's going to be an isolate. We're going to start up being an isolation and a quarantining area, and we know that people who are isolated might need they might need a regular checkup and regular. You have seen that one of the rooms here has got even an emergency button so that they can be able to press if there's anything wrong. And we might not, for 500 patients, we might not need a number of people. I think those who are health care who are health economics, they can give us a figure on how many nurses would actually, require here. But on social media, we're inundated with requests from different retired nurses, doctors who work in private, who've got private practices, who have offered their assistance. And we have a website and a link. I think we'll put it up in our social media that we have been putting up, that people can fill it in, put up their details, and when the need arises, we'll be able to actually call on them. Maybe the other thing that we need to do is just to collate that information and see how many people have actually volunteered. There's one that a nurse who works in England who has actually already started to assist in some of the clinics in Alexander. So we are working with that. I don't think we might get to a point where we need our medical students, but already they are particularly those who are almost at the final year, they are part of the system, so they would be getting proper training and proper development, so that when the time actually arises, we'll be able to actually require them. You must remember that most of them are still at home, so when the lockdown eases off, would be able to then start doing that particular training. The other training that is important, that we are getting the labor union involved so that they also monitor it. It's just the training and the drills that we'll have to do every time in terms of how the staff will be able to treat actual patients. And still at the issue of treating patients, we have started off our first meeting yesterday, which is called it's mortality and morbidity meeting, which is aimed at looking at all the patients that are sick in hospitals and those who have died, and how the treatment was done and what we can learn from all that. So that meeting is comprised of all our experts in different central hospitals, Chris Hanipara, Charlotte Maxeke, Steve Biko, and George Mukari, and some of them in the private hospitals. So that meeting is also aimed at just making sure we improve and get to understand what are the other things that we should avoid. But we are learning quite a number of things, because this COVID-19, it's a new disease entity altogether. So every day we are learning and every day we get new information. And in terms of other facilities, yes, indeed, in West Rand, we are having a hospital. You'll remember that we did report that we have finalized the discussion with Anglo Gold Ashanti and Harmony Golds, and the hospital is getting ready. It's also going to be a dedicated COVID-19 actual hospital. We're also generously being offered their 1,000-bedded hostel, which from that other side of the world, it will be able to cater actually for them. So we are looking at, even in Tshwane, we are looking at how the municipality has been looking at the other spaces where we can be able to put up the structures. But in the first phase where we have been, like I've said, we're just trying to pick up and pull up the facility internally of our healthcare, because beyond this pandemic, we still have to have actual facilities to be available. Is there another question?
Sure, please. Just maybe.
Is there a question I missed? The testing. The testing is, I think I also have to take the opportunity to explain, because, everybody now has this thing about that every time when you then get tested, you're going to get a swab done, So every testing is preceded by screening. So screening, you have to answer some questions that you have to answer, in terms of your travel history, in terms of your contact with an individual or exposure to the virus. And then we talk about your symptoms, and there are specific symptoms that somehow might suggest, might be suggestive of COVID-19, particularly the one on shortness of breath, the acute shortness of breath that comes with a dry cough. And sometimes you do have a bit of diarrhea. So those are questions that we have to go through, like in any other actual screening that we have to do. And then we have to then do an examination that involves your temperature taking, and then when you are pyrexia, like when you've got fever, you've got all these questions in the affirmation, then you qualify to be a person that can be tested, So if all of them are negative, not exposure, not travel history, no symptoms, we still can't actually test you for COVID. but we need to put up our tests that we do, particularly for those who are at high risk, particularly those who have been in contact. So our tests currently are over 80,000. We're hoping to get to over 500,000 by next week, and in terms of screening, and then the tests have been around 2,000, and which led to say that the test results that we have received have been negative, which is a good aspect of the work. And these are the people that we tested at high risk. It means they had close contact with those who are infected, and that's why we ended up actually testing them. We are hoping that SAPRA is going to give us a go-ahead to use a lot of the rapid test kits that are there, but the rapid test kits are also not testing the viral particles. They're testing for antibodies. So meaning that they test, it is only going to be positive if your body has already mounted an immune response. So, but they will help us in terms of making sure that when we screen people, we are going to pick up those who might have been fallen out only on the basis of history and being, examined. So our screening is going to get better. The trucks that we launched with the minister, with NHLS, they are also going to be carrying what we call Gene Expert, which is a rapid test, which also gets the viral particle. But not everybody, like I've said, we will get that test, because we still have to remain a bit rational on how we do the things and put up those who are at high risk. So if you have not been on high risk, I know that I've been on high risk, so I had the test, so I know my results. And those who have never been exposed to anybody, it's the same thing that I ask, about a man who wakes up in the morning with nausea and vomiting can't demand a pregnancy test. Can't. So we also need to maintain that we still have to have some bit of sequence and rationale in the system, how we do things. But we are ramping it up. We are going on the highly densely populated areas where there are high number of contacts and infected individuals, so that we cover the contacts that are there. And it also will make sense that we cover all the contacts that we know before we even start testing any other actual person, and that's how it goes.
So you think
Thank you.
Enough?
Pardon?
So you think it's enough?
No, it's not enough. We have to increase it. There's no way that this part of the extension of the lockdown is also to give us time. And it's not a secret like other people will want to purport. It's not a secret that the lockdown is only for us to be able to get to contain, and know all the known contacts, all the high-risk patients that are there. So it's not enough. If we have done all the known contacts and the high-risk patients and all those who are vulnerable, then we can get to those who are not necessarily in high risk.
Right, so you answered Sidi, the issue of beds.
No, the issue of bedding wasn't answered, but I just wanted to ask a clarity question.
The number of
beds that you have already and whether or not they're donated. But I also wanted to find out the screening process. Are there any considerations around adjusting it? I maybe ask this because you still want to ask about travel history, but we've got local contacts right now. We've got local transmissions, thank you. And then you also have people like Zulizi Mavavi who said, I don't know where people are. So is there consideration around adjusting the questions around the screening process?
Doctors and everyone, health workers are not rigid individuals. Yeah. So they use a bit of logic and they use a bit of sense, so it becomes important that we also have to give them the benefit of doubt, that yes, they do have a tick box type of thing, but they also have to use their clinical appreciation of the patient and also check if they are in essence a high risk and what could have been the possibility. And we know with him, I don't know, let me not discuss individual, because I think we must also be very clear that we don't talk about names of people in public. We don't talk about their conditions, and it's something that we frown upon. We want to maintain privacy and confidentiality. I think if an individual decides to give us a video of himself in a steam room, that's his decision. But I just think that it's important that we give, it will be adjusted, of course, and it will be, people will use their they will use their clinical thing and also know how. But the other things, it will be the symptoms. If the symptoms are such that it shows you the direction towards COVID-19, they will be. Over the weekend, we got a call of a 72-year-old lady around Soweto who went out to the shop to buy cold drink, and now she started to have flu symptoms, coughing and everything. And we had a discussion with the family, and we all agreed that it's not COVID-19, but because she's a most vulnerable group, it's important that we give comfort to that. So we decided that we'll test and do the swabbing for her. So it just depends on situations. So it's not going to be one size fits all type of situation.
All right. Thank you so much, colleagues. Thank you, MEC, as well.